I'm delighted to introduce our federal partners for this part of the session. And I'm not going to read their bios. They all have implored me not to read their bios out loud. So you have a detailed one here. Questions are acceptable, but I think everyone knows the folks up in the front of the room here. We're delighted to have George Sheldon, Julie Boughn, and Jessica Shahin here provide some up-to-date, just-in-time thoughts and perspective on what the world looks like today, or maybe yesterday for that matter, at the federal level. With all of the complexity and change going on, it certainly is a turbulent time out there. And as we begin our journey here for the next couple of days, it's really important as we think about sort of the field to Fed or Fed to field perspective, what's happening on each of the levels. So with that, I will turn it over to George Sheldon, who will open it up. And thank you, George.
Thank you. It's great because when they give an introduction, I don't get an applause. So it's good to be with you. And I think we've been talking about this whole issue of interoperability and how we really make our systems begin to talk together. But I really want to kind of backtrack a little bit, and because we talk in technology terms, but frankly, all this is only relevant if it makes a big difference in individual clients' lives. And I think it's important for us to keep our eye on that ball, that this isn't just technology for the sake of technology. This isn't just trying to love computers, but this is the fact that if we can do common eligibility determination, if we connect various service delivery systems with one another, that can really benefit the ultimate client. I look at Florida, and Jessica and I worked there. Well, she kept coming down a lot, but and we really began doing common eligibility determination. Began connecting the SNAP program with Medicaid eligibility determination, TANF, and it was so important in making different people's lives better. And I think the other thing that we now begin to think about is how can we connect it with other systems. These, it really is more than technology for the sake of technology to create kind of a hassle-free environment. It's not about technology, and frankly, it's policymakers come into this realm with their perspective from a policy standpoint. But it really isn't about them either. It's ultimately about that individual client and making sure the most vulnerable citizens that we have can get the services that they need and the benefits that we need. Having said that, even though these are very revolutionary times, even though we now have the technology to make things interoperable, there are a lot of barriers to that, and I think that everybody knows about those. I look at trying, for instance, to create for the child welfare system an interface with education, and we've been trying for some time to do that. And there's this thing called FERPA, if all of you are familiar with it, that lawyers have interpreted for a long period of time to basically say we can't share education records with the child welfare system. But if children are in the care of the child welfare system and we're not able to get those records, then how can you meaningfully deal with those individual children? And so I think there are not just perceived legal barriers, there are also real legal barriers. There are also resource challenges. As I've traveled this country, I look state by state, and every state has extreme budget constraints. And those budget constraints are impacting their ability to really think beyond just today. In addition to that, I think the main barrier to all of this is really not a technology barrier. It's not a statutory barrier. It's not even a resource barrier. The biggest challenge I think we have is a mindset barrier. We protect our information. Every agency, and it's true also just within my own agency with ACF, we say this information belongs to me. And I think that is a challenge that all of us are going to have to deal with. When I went to the department in Florida, I called the lawyers in. We had 400 lawyers in the Department of Children and Families. I mean, if you have a problem, throw 400 lawyers at it. I called some of the senior leadership of the lawyers in. I said, look, as a former Deputy Attorney General, a former Associate Dean of Law School, I can hire lawyers every day who'll tell me why we can't do something. What I really need are some lawyers who'll tell me how do we get where we need to get. And I think that's what I'm talking about really in terms of this mindset challenge that we're going to have to deal with. And I think it's something that every agency, including your own agencies, those of you who are running an agency, are really going to have to turn around. And that is a willingness on the part of agencies to share information. And I think that as we move that forward, I think I'm asking each of you to kind of look back and say, all right, what can I do to break down these things instead of what can I do to keep it going? That's why I'm pleased that this conference is being sponsored by Stewards of Change and not stewards of the status quo. That we really ought to be talking in new terms. The partnership that we have with CMS and with Food and Nutrition Administration really is a partnership that I think can make a huge difference as we move forward. Now, Julie will be the first to tell you that there are some very strong target dates.
I'm going to be the second now.
They're very strong target dates as to the Affordable Care Act and meeting that. We're committed to making sure that CMS gets the insurance exchanges up and running on time, and that what we do on the health and human service side, on the human service side, doesn't delay that. But I don't think that where we're coming from is inconsistent with full implementation of the Affordable Care Act. I'd like to just give really two examples of where some coordination, particularly between CMS and states and us, make a difference. One was Rhode Island. Are you here? Well, it was one of those really where Rhode Island got on the phone with us. I think Joe Bodmer, you were on the phone. Actually, I think I even have your name here.
A lot of people on the phone.
Sharon.
George, we can get interpreters for you.
Yeah, I like this.
Sharon's our child support
Okay.
associate director, and my name is Deb Buffy.
Okay. Good to meet you.
Tomorrow, and then Amy Love.
Okay. Well, it's a good example where Rhode Island was on track, and a simple phone call got people on the same page, and I'm very complimentary of what Rhode Island's doing. Another of those states is Virginia, and I think what Virginia is really doing in terms of really trying to develop an enterprise view of data and information system, I think is laudatory, and I really hope that people kind of interface with you here, because I think you're kind of setting some of the new parameters of where we really ought to be going in this whole arena. I think Joe Bodmer, is Joe here?
Last night.
Okay. He's working so hard that he's probably still sleeping. But we've established an interoperability project management team within the department. And Joe has responsibilities at child support, as you know, but he's also leading that team. I also asked Ramin Kuzakanani. Ramin, kind of wave your hand. Ramin was our chief information officer in Florida, and is devoting about 20 hours a month to really providing some strategic vision to where we're heading on this interoperability management team. But my view is this really is about helping the states. We've worked with Johns Hopkins here for the last couple years in developing an architecture for interoperability. And I would encourage, I would like to see one or two states really take a look at this architecture, review it as we refine it. Hey, David. David was the previous Assistant Secretary for the Administration for Children and Families, and as I've said before, he passed me the torch. I didn't expect to get it flame first, but I do want you to look at this architecture, and if there are one or two states who can really work with us in terms of reviewing this architecture, determining its suitability to those states, I think that will help other states as we begin to move forward. They're really, you know, I remember when I first started in government that we had more questions than we had data. Now we're flooded in data. And we have so much data that, you know, I think it's very difficult for us from time to analyze that data. So what I'm hoping can come out of this is not just the dialogue between the three of us, but you're going to be kind of tasked to develop short-range and long-range action plans. And I'm looking forward to seeing the results of those action plans and seeing how we can improve what we do, respond to those action plans, and how we can adjust internally our activities to assist you as you move forward. So we're in this together. I don't feel that we could have better partners than Julie and Jessica as we move forward. And I look forward to an ongoing dialogue. Julie?
Thanks, George, and thanks to all of you for traveling to Baltimore, making it very easy for me to attend this meeting because I just live a few miles south of here. And thanks to Daniel and his team for putting this whole thing together. And I couldn't agree with George more on the name of this. For those of you who don't know me, I came to the Medicaid and CHIP world really literally last August. And I won't bore you with that long story, but my career before that is all information technology. You know, starting out after college and then sort of just building my way up. And then eventually I was the CIO at CMS for almost 5 years before Penny Thompson had the brilliant idea to have me come over to Medicaid for a little while. And I thought, why not? So, you know, I think I bring this perspective to it, and that maybe some of you, and I know some of you in the room, and know some of you are newer to this world of the Health and Human Services arena in the states, where the federal government and the states partner. And a lot of us sort of go, would we do it this way if we were starting all over? Was a good point earlier this morning, right? If it was now that we were starting, would we do it this way? And I think that is almost the perspective that we tried to bring to the regulations, right, that were recently finalized for the Medicaid and CHIP expansion and for the exchanges, right, which those regulations together envision a brand new business process. It's not really tweaks off the old eligibility world. It's new. And it's client and consumer focused, whatever kind of the word is that you want to use on there. It's automated decisions. It's real time. Real time, I put that in quotes whenever I say that. I'm an IT person from longstanding. Your real time and my real time might be different definitions. And my colleague Henry Chow is sitting here, and we've been working together for a number of years, and Henry will call me on real time any day of the week. At any rate, but I mean, it's verifications that happen, you know, while the client is trying to apply for coverage, so that you can get those automated decisions that we talked about. And so those business processes necessitate really kind of starting over, right? And saying, how is this world going to look? I'll be the second person to say to you that those deadlines in the Affordable Care Act mean a lot to CMS. And the ability, you know, starting October 1st, 2013, really, to be able to handle people coming to the doors looking for affordable health insurance coverage is the paramount thing for us. I want to put the foundational pieces kind of back out in front of you again, because it's part of your job over the next few days is to come up with those short and long-term action plans. And some of the building blocks that we've done out there, in addition to the regulations, which really speak to this new business process, are what we call, and probably you all call, maybe the 90-10 rule. The rule that we're in the Medicaid and CHIP world. We're looking at the Affordable Care Act, and it wasn't me at the time. It was Penny Thompson and a number of other people saying, wow, this changes everything about eligibility. And we only finance eligibility systems changes at 50%. And the exchange grants are going to be 100%. And there's something wrong with that picture when you have an A87 cost allocation requirement. So we need to figure out what's the thing that we can do to help states really address this eligibility challenge that they're going to face in 2013 and 2014. And the result of that was the 90-10 rule, which was not an easy task to get through the federal government. Office of Management and Budget, you all have budget departments in the states and counties, right? Are they ever like say, sure, spend more money? And OMB is no different, and we love them for it. They do keep us honest, but it was no easy task to get that regulation through. But we did get it through, and it got through because of a couple of different things. Number one was what we'll call the 7 standards and conditions, right? And we said these are the requirements of this information technology. So in addition to, kind of the business processes being blown up and needing to be dealt with, we're also saying we want you to look at information technology in a different way, right? We want it to be built in a certain way. We want it to be built in an interoperable way, right? We want it to be built using standards and all those things that are in the 7 standards and conditions. And I'm putting that back out in front of you because I'm actually putting it back out in front of our team. It's almost in some ways like we published that document and said, yeah. And now the planning documents, the APDs that come to us to approve for funding, generally say something like, we acknowledge that there's the 7 standards and conditions, right? Well, I want to make them real, right? And I want to make them really kind of come to life as much as we can, along with CMS recently published MITA 3.0, okay? I acknowledge the E&E pieces aren't there. Look for them in the next month or two at the most, and they'll be out there again. We had to wait for the rules to get finalized, and now we're cleaning up just a couple of things to get that out. But MITA 3.0 really kind of speaks to all the business, the major business lines of Medicaid and CHIP and the broad business processes that support that. And so when we think 7 standards and conditions and we think aligned with MITA, right, which is one of the 7 standards and conditions, we're looking for those business processes, right, when we're building the systems. So the 7 standards and conditions are there. And then last but not least, and probably of most interest in some ways to this crowd, is the A87 waiver. And the first tri-agency letter that announced the A87 waiver, and then the second tri-agency letter which listed shared services that are applicable under it. The first one was the most monumental because what it said was, if the federal government is helping to finance systems for doing eligibility for the health insurance programs, and the human services programs in the states want to take advantage of that technology, they don't have to cost allocate the common pieces. That's a big deal. Because that's never been the case in the past. You would have always had to go figure it out. We would have had long conversations. We would have had our partners at the table figuring out what was the right cost allocation. It would have taken a lot of time and effort. Now it's none. You don't have to do that. The second letter, the second tri-agency letter, which was, the second tri-agency letter almost reminded me of when I was a new manager in the federal government. One of my employees came up to me. I was, like 27 at the time. One of my employees came up to me and said, do I have to take leave for the picnic? And I looked at this person and I said, well, there's a right answer to that question, and I will give you the right answer to the question, unless you would like to withdraw that question. Because if you're going to ask the question, I'm going to have to say, yes, you're supposed to take leave for the picnic. But the what shared services are applicable under the A87 waiver sort of fell into that category. It's like, sort of like, don't ask me, let's figure it out as we go along. So I deliberately worked to keep that list broad. Rick Friedman will tell you because we worked on it together, and we were trying to keep it very high level, very broad, and not preclude any creativity. But it's there, and it lists things like data warehouses and master person indexes and client portals and kind of business rules engines. I want to talk a little bit about this, sort of dive down into the work that you were doing and talk about a little bit of best practices as states, although I'm not going to name any. But I will tell you that more than 20 states currently have either planning or implementation, and most of them are implementation at this point, APDs with us, where they are explicitly invoking the A87 waiver. It's explicit. There's a number of other states that have planning documents with us, and we think they can, but they haven't explicitly said we want to invoke the waiver. I think some of the things I will tell you that are characteristics of these in terms of best practices are, and I have to say this, health first, right? The health programs need to be the first phases or early phases of the project with the ACA deadlines and explicitly called out. Business rules engines, where we can separate the business rules themselves from the underlying infrastructure. That's a best practice in these things, because I think that that's what enables, or that helps to enable the interoperability later. We're integrated client portals. It's probably goes without saying. I'll pile on to George's calling out of Virginia. It's just one example, but the master person index is the single source of truth of data about people is critically important. It's a lesson that Henry and I learned in the Medicare environment when we implemented Medicare Part D. Our boss used to say, well, if I have 6 watches on, I have 6 different times. He is famous for that one. The other thing I will say is, I'll just re-emphasize again the automated decision making. Every one of these projects that's really kind of invoking this is planning on doing as much no touch or low touch processing as possible. So they're looking for verification sources, of electronic verification sources for data. They're looking for ways that they can automate the process. It's just all about not trying to touch the people. When you think about the millions of people who are going to come to be connected to health coverage, starting late next year, it's going to be a heavy lift if we need to touch any of those, even if it's just to say, yep, that looks good, and approve it, right? And we do have processes like that in our systems today. So there are project teams in these cases where it's very explicit and they're working together, generally led by the health part of the state, but always with the human services folks at the table. And some of you are involved in these efforts, and I know what you'll say is it's actually really hard to spend the time looking at the business processes again, because remember, we're starting over from scratch with business process and working on where do I connect with the SNAP program here? Where do I connect with the TANF program, right? Let alone some state-based programs that are also trying to be engaged in that. But it's going to be so worth it, right, later on, when we can do this in a low-touch, no-touch way. I think there's probably 2 keys that I want to leave you with, and then I'll stop talking. The first is that shared vision, that low-touch, no-touch, automated decision-making. That to me seems like a key element to successfully driving those projects forward. And I will tell you that certainly, and I'm going to go back to our regulations, the federal vision, right? The federal, when we were thinking about how does the eligibility process work for Medicaid and CHIP and the exchanges, we were thinking, one, as a client, as a consumer, I don't need to know what program I'm supposed to be in before I come in the door, right? I just come in the door and start applying. And 2, that it's real time behind the scenes, and I'm sure Henry's going to talk about some of his works with other federal agencies to try to make that happen with the Data Services Hub this afternoon, so I'm not going to dwell on that. But that these decisions are automated to the maximum extent possible, that they can happen while the person's on the computer, just like when you go to Orbitz or Travelocity or whatever and book your trip, right? It just all happens right there. You don't have to talk to a person at all. And I like doing a lot of my business that way, and I think that that's sort of the vision that we're having. So I think those 2 keys are the success factors that will make this work. So, and with that, I'm going to let Jessica talk, because Food and Nutrition Service has a big role for us in this. So.
Yeah, hi everybody. It's good to see some familiar faces, and I look forward to meeting those of you that I have not met before later on and throughout the day, because I plan to stay here. I want to hear what's going on and how y'all interact. I also hope that this panel is going to have some opportunity for interaction, because I think that's the best way we're going to be able to actually know what you think, and we look forward, as I think George and Julie have already said, to seeing what comes out of this symposium, because it is important for us to listen. We're up here talking, but the truth is it is important for us to listen. Does that mean we will agree with everything we hear? Not necessarily. Does that mean that we can do everything you would like us to do, even if we do agree? not necessarily. But it does mean that unless we listen and unless we hear what is important to you and how you think we can make this work, we are not doing our jobs and we will not be successful. So I want to thank Stewards of Change, Daniel, you guys for bringing us all together into one space so we can do this. I'm not going to spend a whole lot of time on today's SNAP world. Does anybody think that SNAP is just ready to start taking on more money? Give more money to SNAP, right? No, that's not what's going on out there, folks. SNAP is a program that has grown just as it is designed to. The program is designed to respond to the economy. It has done so, and in doing so, it has become a target because it has become so large. And so there are lots of people out there that think there must be something wrong with the program that it's had this growth. Not true. There's something right with the program that it's had this growth, and as the economy gets better, the program will get smaller. But right now, nobody is interested in this program growing. I'll be talking in a few minutes about how that's going to present a challenge for us. I think that the truth is that our opportunities are our challenges when we're looking at integration and interoperability. One opportunity and challenge is just to maintain the connection that Health and Human Services currently has. How many states sitting here have some version of an integrated eligibility determination? When you're determined, most states do. 40 states actually do some kind of common determination of eligibility across the 3 major programs that are represented here. So just maintaining that connection in this environment is one of our opportunities and challenges. But I think you're hearing, boy, the real opportunity is how can we improve that? How can we increase that for the client experience? Julie said it, George said it, they said it different ways, but it comes down to the client doesn't need to know. This should all be transparent to them. Do they really need to give their name, address, social security number 4 to 5 different times in the same day? I don't think so. I don't think so. Now, there may be some stuff. One of our challenges, George talked about it, boy, we need to be able to share that data better. The rules and the policies may not use that data exactly the same way, but having access to that data so the systems can figure out how to work it, that's what we need. Is there anybody in the room who does not share the vision, the hope for that fully integrated intake system? I mean, I don't think there's anybody here. We all share that vision. Sometimes FNS says, our vision is, CMS, our vision. Put it all together, we all share the same vision. The states, the locals, the counties, the feds, we all want that. We have struggled with that for, I've been saying 20 years for about 10 years, so I think I'm going to change it to 30 years now. And I think one of the real beauties that has occurred just in the last 10 years is that industry has said to us, okay, we're going to give up that you all have to have the same policies. We have started to understand that where we wanted you to have all the same policies, all the same definitions, these kinds of things, it's probably not going to happen. You have different committees up on the Hill, don't you, who have different interests and different concerns. And you'd have winners and losers depending on how you define, which is another whole thing to deal with. So what we have right here, we are there. We can do this. We don't have to have integrated rules. We just need to have integrated processes and integrated systems, and we can do that. That's going to let us have what we all want, and that is the client outcome of the client doesn't need to know. They just need to provide the information, and then we take care of it from there. We've got some potentials. SNAP and medical assistance. When Julie was saying, we're new. We got new stuff. We're new. And I was thinking, God, we're not as new as that. And we're not. SNAP is not as new as that. We've changed. We've evolved. There's a whole lot of flexibility in SNAP that didn't exist 10 years ago that does exist today. What do you want? You want more flexibility. Most of the flexibility would cost a lot of money. Not in a real good place currently for that. I don't think it means that we should let go of it. But I do think we have to consider where are the places where we can be flexible. Where are our opportunities, and not dig in on the ones that we're not going to get. Let's go for the ones we have the chance to get. One of the things we're talking to CMS about, we are fortunate in that CMS agreed to have monthly calls with SNAP. So we get on the phone with them every month, and where are you on the rules? And if your rule's going to do that, this is how that's going to affect over here. It's not that we can necessarily change anything or do anything, but it is important for us to know and understand so we can start anticipating. There are some real opportunities in the SNAP case files. The SNAP case files are extremely rich with data. Why? Because we ask a lot of questions, don't we, George? Oh my gosh, in SNAP we ask a lot of questions. We ask for a lot of verification. We just like to have everything we can possibly get. So those case files could be really helpful to Medicaid and to the exchange, to everybody. Plus, there's probably about 4 million people, I think is what we figured, that are on SNAP today. You might be able to just put them on Medicaid because everything in the case file, if they're getting SNAP, they're eligible. So that could be, when you're drinking from that fire hydrant like the states and the counties and the locals are going to be when all of this happens, it'd be nice to be able to take some low-hanging fruit. So that's a real opportunity for us. We have some major differences that are going to be tough, but I think this is one of those places where we don't let the tough get us down. We let the systems work for us. And this goes back to, Julie's absolutely right. What do you do first? Where's the urgency? You heard the sense of urgency. Health, the exchanges, Medicaid, all of that's got to go first. But states have the chance to think about this from the beginning on how that's going to intersect with the human service programs. And a couple of the things that will be different that would be really good to be thinking about early are things like household composition. Medicaid is now going to look at a household in a different way because they're going to be using MAGI and IRS. And so a household becomes according to how you're doing your taxes, right? Pretty close. So let's use a household that is getting SNAP and getting Medicaid and think about, or exchange or any kind of health insurance, and think about how that household is viewed. Well, if it is a grandmother, mother-child, mother's boyfriend, in SNAP, that's one household. That's how we define it. That's one household. But when you're looking at MAGI and you're considering that income and how that's going to work, that is 3 different households, if I'm not mistaken. Mother and child, grandmother, boyfriend. Or it certainly could be. Certainly could be. So in any way you look at that, you got a little thing going on there where not going to have an exact match. So there are also going to be some things around income sources and how those are counted that we're going to be struggling with. Those are things we need to hear from you. We need to think about ourselves. We need to consider, and we need to look at systems to help us do this, because they can. States need to think about, do you want to build that system with the integration right up front? Or do you want to build it with thoughts of how you're going to integrate and interface with your systems. Either way, please, please, please maximize your 90-10. How often do you get a 90-10 match from the federal government? I had somebody come to me just last week to say, you remember back when you had 90-10 money? Is there any of that left? Because we could really use it. And I'm just like, okay, we are 20 years ago now. No, there's not any of that. But there is some. I don't have it.
I don't have it.
CMS has got it. And they are ready for you to use it within those confines. And don't let the confines scare you. Find out what they mean. See how that's going to work. It's a real opportunity. I would like to also encourage, as a part of this discussion, that if you're going to build for health now, and just think about human services building on later, if that's the way a state's choosing to do. And I think most states probably can't help but think that's what I need to do because of the sense of urgency. Please, if you are the health people, make sure your human services folks are there at the table, even if they're not going to be at the ground level. Make sure they're in the room. And human services folks, go ahead. You don't mind kind of squinching yourselves in there. Make sure you're there. Make sure you're there. Be a part of the discussion. Think about the long term. Short term, urgent, got to do it. That's your focus. That's fine. Don't forget the long term. Make it a part of your planning process. So, once again, George and Julie said it, but I want to say it as well. I want to make sure everybody in this room knows that we need open discussion. We need to hear from you. We need to know what you think will work or not work, what you think is important, not so important. We need some thoughts on how to connect, how to use the data. Where are the barriers for the data for you? APHSA, Anita just came and saw us recently, and we talked about, we hear from states that there are some barriers they run up against when it comes to data and how they can share. We know what a couple of them are, but we don't think we know what all of them are because they're not our barriers. They're the state barriers. So we'd sure like to know more about that. We want to support very much, as Julie was talking about, that process improvement. It doesn't work as well when you build a system or technology around a broken process or an outdated process or a process that hasn't been reviewed to consider, is this really the way we need to be doing business? So we really want to support those process improvements that let you then build your technology in a way that actually works. And in SNAP, I know this is true probably for Julie and George as well, but going back to my initial remarks, whatever we're doing, it's going to have to consider program integrity. In a program as large as SNAP, integrity has to be a part of the full administration of the program. Even 1% is a ton of money when you're talking $70 billion. And so the expectations of the program are such that we look at administration of the program in its fullest sense. We have found, it used to be thought that you could not have access and integrity in the program, that those two were not a match. That is not true, and we have proved it in SNAP in that we have seen our participation among eligibles over the last 10 or so years go from 54% to 72% at the same time that as our error rate went from almost 9% to below 4%. Those are the times I got to go down and see George and visit with him to find out how he was doing exactly that He was improving access, he was improving integrity, and the beauty of it was I got to take him a check all about it. So that's the other thing. We can help pay for things sometimes if we are seeing good administration of the program. Is that telling me I've used up my time? I can take a hint, Daniel. I can definitely. I think that's exactly where I wanted to end.
Currently, each of your programs still have that legacy notion of your individual security policy, what data can be commingled. And almost like the A87 waiver discussion, to the degree that you could come together with a more cohesive security policy and talk about, for services like MPI, Master Patient Index, what data is allowed to be shared and how can we make those services work more intelligently. Having that kind of vision and that kind of statement from you folks would be real enabling for us to take back to the state, and for some of the folks who look to you to set policy on security, it would really help us break down some roadblocks.
So I think I'll just comment on that briefly, because I definitely hear the plea, and maybe we can talk about this a little bit separately, some of the things you're doing on this, because this is a challenge that we're working to address at the federal level because of the hub, the data services hub, and the need to sort of use it for verifications. I'm sorry. Okay. The fact that information is not just coming from our three agencies, right, but it's also going to be coming from IRS, SSA, and others, right? So what we're working on trying to do is figure out a way to, I hate using trendy technology buzzwords, but harmonize those security policies so that we can sort of give one set of things to states and say, you have to meet this, right? And then in some ways it would become an effort of working with individual states with where they are in terms of their technology to make sure it's implemented in a quote-unquote acceptable way, right? But we definitely hear you on that need.
And not to pick on the SNAP folks so much, but you still have words in your policy about your data being partitioned and separated from everybody else. And that may be okay back in, I find it hard to believe folks can't hear me that well. Even to the degree, again, with Master Patient, that now in the new world, not all services are created equal. So as you look at your security policy, that some data shared at a MPI level would be okay, but maybe later on when I'm actually down in the bowels of the program, partitioning may still need to be a piece. Have your architecture represent that, your security represent that.
Thanks.
Just one follow-up, and Joe Bodmer did come in, and he was not sleeping, George.
I'm sure he was working.
I understand he's putting together a grid of the areas where policy may conflict. And, I'm very glad that he's doing that, but I hope you all are able to act on that fairly quickly. And if nothing else, some sort of document coming from each of your agencies saying that with regards to eligibility determination, it is the intent of the agency that we want to go this way. As an affirmative statement from each of the federal agencies that this is where we want you to go, because all those legions of attorneys that you had in Florida, they've moved up to Virginia now.
Well, I think what Joe has done, both in terms of the action plan that we put together, and part of that is this whole confidentiality and the security piece. But what I really want is prior to us, and I'm speaking for ACF now, prior to us putting something out, I really would like you all to review some of that first, because I think the extent to which, I have one advantage is I came from a state, so I understand some of the difficulties at the state level. And I frankly think it may be a little easier for us at ACF to do for our programs, because I don't think we have some of the statutory restrictions that, say, SNAP has. I mean, SNAP has a lot more than TANF, for instance. But I'm committed to working with you, and I also recognize the urgency of getting this out fairly quickly, because you all need to move along. Go ahead.
The only other thing I'll add is that from our perspective, we're being helped greatly by Steve Van Roekel and Todd Park, who are the CIO and CTO for the U.S. government, and they're basically, I wouldn't say they're spearheading, because I really think it's Henry who's spearheading the work, but they are definitely spearheading the multi-agency conversation that needs to happen so you can get to a cohesive set of policies.
And from SNAP, I'd like to have Henry's and John's cards, please.
We don't tell people how to get in touch with Henry.
Yeah. I don't even have pen.
I'm Ivan Handler from the state of Illinois. I'm the CTO of our Office of Health Information Technology, so we're building the statewide HIE. This is a great session. I have probably too many things to say, so I want to boil it down to just two quick comments. I think one of the things that I want to point out is, though it's clear that the lack of interoperability is a cost driver, and I want to make it clear that, at least from, I think, many states' perspective, interoperability means things being defined exactly the same, working the same. It's not a question of how we resolve differences, it's a question of eliminating differences. But the other cost driver is redundancy. It's nice to have the MITA the MITA architecture out there, but if we still have 56 MMISs at the end of the day, we haven't really driven the cost down. And I think that's really important to keep in mind for a lot of states who are in economic crisis, and Illinois is certainly one of them. It would be nice to not have to do all of the things that are common, that are defined in federal law. It'd be nice if we can concentrate on the things that are specific to the state of Illinois. That's big enough, I think, for us. The other thing I wanted to point out, the universal intake system is another thing I'm concerned about. And the reason for that is there's really, to my mind, two ways of looking at this that are important. One is the back end. The data policies, the things that need to happen at the back end that should be uniform. The other is the front end. For example, the state of Illinois is a huge state. We have an incredible amount of variation in terms of who comes to look for state services. The city of Chicago has, probably only New York City is more complicated than the city of Chicago in terms of the kinds of people, the kinds of organizations that are there to help with these things. And by the way, it's not just, traditional HHS. We've also got energy assistance, weatherization. There's a huge number of things out there. I think it's better to have the state provide the infrastructure and the back end, supported by the feds, and then allow the marketplace, allow entrepreneurs to come in who can focus on the specific needs of a lot of these community organizations who are our partners, who save us money, who are in contact with our communities, and to break apart the front end from the back end. Don't try a one-size-fits-all for intake, because I don't think it will work very well. But there is a role. There is a role for the back end. And I think if we can think about these kinds of things a little bit more subtly, because today the technology exists to allow us to do these things. 10 years ago it didn't. But now it does. And then I think we're now talking about really powerful solutions that save a lot of money and are easier to maintain, because that's the other thing that costs a lot of money. For anyone who's been involved in IT, is maintenance is by far the overwhelming problem. It's easy to build a system. No matter how much it costs, the maintenance is going to kill you in the end. So those are my two initial.
It's me.
Yeah.
Deb Buffy from Rhode Island, and my focus is a little bit more on the programs and the operations versus the technology. But my colleagues here, Lisa, Amy, and myself, because Rhode Island is so small, we've been able to be very involved with the HIX and actually the Human Service Program, SNAP, and food stamps. And we're a perfect example of being, muscling ourselves to the table with a lot of help from my colleagues in Medicaid. So, and as the Assistant Secretary points out, we've taken advantage of the IAPD process, and we've gone through the whole process. And for the HIX and for a brand new eligibility system, which we are so excited about in Rhode Island, we have all the funding is already worked out, and we know what we're approved for. So having said all that and being very appreciative of that process, we've also been undertaking significant process evaluation of access to benefits in terms of business process. So after all that, my comments are a little bit narrative, and at the risk of, the SNAP world, I think what we find is, as we're really studying this, the verification and the processes and the rules in SNAP are really second to none. And so as you would like to consider the comments, the verifications are killing us on errors, and as we look to alignment in the other programs, because we believe that's important to our customers, the SNAP verification requirements go beyond, with some of the other programs. And the waivers are great because they provide flexibility, and we appreciate that. But bringing them all together, and once again, the bureaucracy of making them happen, and the data analysis and all of that, we very much appreciate the flexibility, but there's a lot to it. So as we look at the technology side, I believe we still have to deal with the rules and the processes. So I'd like you to continue to consider that.
You're absolutely right in terms of that there are the other things. One of the things that I would just suggest when you go through your business process, sometimes, a lot of times, states find out that they have maximized it. Some of the verifications are not the federal requirements. They're things that they've put in place. And so SNAP actually has been, over the last few years, encouraging states to look at their verification requirements, reminding them of that these are the ones we absolutely require. If you're doing anything more than that, you might want to reconsider that. It may not be necessary. And we actually have some stuff that we could provide to you. We have a matrix that looks at a variety of things. In terms of the policy waivers, the administrative waivers are not so onerous, and some of them we can do very quickly. Some related to the interview, moving that to a telephone interview away from the face-to-face interview. We can turn that around so quick because we just basically think that's the way we should be doing business. Others are a little bit more complicated because we've never done them before. And a lot of, especially the demonstration projects, but even some of the others, we have to look and see that we're staying cost neutral. And so that comes to a lot of that kind of onerous reporting back to us kind of stuff. So if there are things, though, that you think we could do to get that information and get that kind of thing going and make it less onerous at the same time, we'd be very happy to talk with you about it, because we don't mean to be as much of a pain as we are. There's someone right over here.
Hello, I'm Shahin Messick from the Oregon Health Authority, and I'm with the Title V programs. And two comments. I agree with everything that's been said so far, and I'd like to throw in some additional parts that I think have been missing, and that is on the food nutrition side, there's a lot of local resistance to sharing. And I think while we may not be able to overcome some of the policy and technical issues immediately, getting national guidance that it's okay to share, it's okay to explore ways of sharing and interoperably using each other's data to improve services will go a long way towards sort of local innovation. The other part of it has to do with, if you look at local health departments or local agencies, their information systems are usually sort of a wasteland of every other grant they've ever received that just said build a system. And trying to retire those and build new ones or replace them with some sort of integrated solution is a sort of a heartfelt desire, but there's no funding for that. But one thing we'd like to see changed is your contracting methods for grants. Can they allow for, instead of a nice discrete deliverable of build a system, instead use an existing system? or give benefit to using existing systems or integrating or building onto existing systems so that we don't have this sort of wasteland of incompatible, redundant systems. I know when I first worked with NACHO on their informatics work group, we met with Stephen Thacker at CDC, and we raised, well, can you take on the contracts issue? And he backed away. He said, no, that's not an issue. We can't deal with that right now. Policy we can deal with, but contracting procedures and deliverables I can't get into right now. So I think that would go a long way towards helping us promote interoperability if we can simplify how you give us our wonderful grants and opportunities to explore research in different areas.
So I want to make sure I understand that comment because, well, you're using the word grants, and we don't do grants exactly in Medicaid and CHIP. So is your comment specific to grants?
Grants and contracts, because the methods that they are delivered essentially specify a single system to be developed.
Well, I think probably we should have more conversation because the APD process, right, is where, the state sort of basically says to us, here's what we're thinking about doing, right? And there's nothing in that process that precludes an enhancement to an existing system, or it's basically meant to be a conversation between us and you, right, about what's sort of the best approach to accomplish some particular business objective, right, involving some IT system. And so there's not anything in that process that would say you have to build a new system as opposed to use something else. I mean, as an IT person, I will tell you sometimes a new system is better than building. Everyone thinks reuse is great, but sometimes when you repurpose something, that's not so great. But that's really kind of to facilitate the conversation. And typically, contracting is a state issue, right? It's governed by state procurement laws. There's some federal things that we want to make sure happen. We like competition and other things like that. But I mean, that's really how the state runs its contracts. So I mean, I'm not. We'd have to sort of maybe offline dive into the details of the particular situation. But there's nothing that we're doing that I can think of that would preclude it. Rick is way more expert than I am in that. But are you nodding at me, Rick? Am I right? Thank you.
What you raise is really interesting that, instead of going out to the universe, if you just kind of look within an organization, it's very hard to build, fund, and sustain shared services. And I can tell you in CMS, we have about $2 billion annual budget in IT and 18 different funding streams from Congress. And there's kind of this color of money issue, so that when we build things like master data management and enterprise identity management, there's this kind of notion that you have to go out and fund this somehow because OMB doesn't fund individualized capital investment projects. They think that we're going to waste that money. So what you have to do is you have to go out and scrape and beg all the individual lines of business to contribute some of that money to build the shared service, and then have a contracting strategy that allows you to add money to it instead of having it all prescribed, kind of on a 1-year base, 4-year option. So what you're asking for is very lofty and it is highly desirable. But I don't think even a single organization has figured out that when it has multiple funding sources about how to build shared services going forward. But what you do raise deserves the attention to have some very smart people that understand the execution side, not just the reason for doing it. It's kind of like what Stephanie said in the beginning, it isn't about just the objective, it's the outcome. There's the folks that know how to get this done, the contracting folks, the budget folks, the IT operations people that can take this great idea and actually make it happen. So I think that I'm not trying to say that that's not a good thing to ask or it's impossible. It's just that I think we often specify the objective, and like it was said earlier, we don't define the outcome, and we don't measure it, we don't implement it.
Hi, Alice Wyse with the National Academy for State Health Policy. I think this panel has been amazing, and I love to hear you all reiterating the shared vision of integration. At the same time, I guess I work with states on a regular basis and hear from them about the challenges that they're facing in terms of making it real. So I was really interested to hear Jessica's comment about that matrix, about the federal requirements, and I'd love to figure out a way to make it more widely available. Is it already more widely available? And I have a second question also.
Okay. The first answer is pretty quick. The matrix relates to workload management and the various things that can be done to manage workload, including things from technology, policies, administrative processes, and those kinds of things. So that's the matrix I was referring to. It shows what states are doing any one of those. It indicates whether it's expensive or fairly inexpensive to do, and it also indicates the advantages and disadvantages of any one of them. So, and I think it's on our public website. But if it's not, come and see me, and so that I have your card, and then I'll get it for you.
That's great. I thought I heard you say that it was something that specifically outlined sort of, you know, where the federal requirements were versus the state requirements, and that I think would be a really, if to the extent
that I can get for you too, because the requirements, the verification requirements, are in the statute and the regs.
Right.
Is where you find them.
Right. So beyond that, I guess I wanted to think about whether or not, you know, as I know CMS is in this process of meeting with states on a regular basis and trying to promote at least interagency movement within the existing programs, let alone human service health programs, let alone human service programs. I wondered, have you thought about, or is there an opportunity to include representation from other federal human service agencies in those conversations, especially for the states that are considering an interagency, you know, horizontally integrated sort of model of eligibility?
So I think we'd be open to it. I mean, the conversations, I'm assuming that there's kind of a set of conversations that are happening between us, because my colleagues in CSIO are meeting with their grantees in the states. We're meeting with Medicaid and CHIP agencies. We're doing our level best just between CSIO and CMCS to be integrated and speaking with one voice as we can. It's a little bit challenging because some of even just the statutory requirements are different across the two programs, and certainly they have grants and we have APDs, and that's a little bit different too. You know, I would tell you that especially as we're moving forward, we are really focused on the health goals, but we also have a lot of guidance that we have in development, right? And some of that guidance is all about being more interoperable and how can human services kind of play a tighter role with the eligibility processes that we sort of laid out for the health programs. And so some of that's kind of being developed right now. And so I think that there's definitely room for that, you know, and we wouldn't be opposed to it in any way, shape, or form. And if we needed to invite our colleagues to participate, we would absolutely do that.
Sure. Steve's got it.
Quick question. Steve Emanuel from the state of New Jersey, and I am very new to the state, so I'm learning a lot of things, but I had to sponge off the color of money statement because that's one of the challenges that I seem to be facing quite frequently. Not only the color of money that's coming in, but the color of money that has come in, which is preventing people from being proactive about trying to figure out how to do collaborative services. So from a federal perspective, who are the people that you can talk to, that I can talk to get people to be creative about new money and making decisions about old money that has been spent? Because if we don't come up with a method to address the horizontal components of the technologies that are going to provide these shared services, i.e. the infrastructure, the planning, the communications, you are never going to get to a true common shared methodology. And given my involvement with BTOP lately, if they can change the rules about how money was originally divvied out and how we can spend it now because there's been some changes and the dynamics are different, how can we do the exact same thing for health services money that's coming in? So that if I'm creating a planned services environment that one agency can use, so Medicaid can use it, but I see something for human services, and I've talked significantly about a master client index that we're trying to develop. We've got 10 of them. I can't even consider building something that will allow them to share a master client index for common intake, for common information, for common client information, because everybody hides behind that, well, we got that money for this and you can't use that hardware. I'm like, we got to stop this. We got to find a way of doing it. And I'd really like to see it driven from the federal perspective saying, as part of the requirement for a grant, you need to demonstrate that you must do this as a silo and why. Otherwise, you get more credit for figuring out how to do it collaboratively and sharing across different environments.
So I think that that's the beauty of the 90-10 rule and the 87 waiver, right, is that there are the carrots, if you would, for doing that, right, starting with the health programs. And I would encourage you in the course of the couple days that you're here to connect with your colleagues from Virginia, and there's probably some other states here that are doing it, who have really figured out how to use the health money, right, to build an infrastructure that can then be taken advantage of by the human services agencies. And if there's a need, again, to have a specific conversation with you all, and I can bring my colleagues to the table, right, and we can help to inculcate that culture change, if that's what it sounds like it almost is, right? Because what I find, you know, and being sort of relatively new to this world myself, is that that's as much of what the problem is as anything else, right? It's not about, this is the smartest way to build IT systems, right? So we're going to do it this way. And it's not about this is the cheapest way to do things, right? It's about this is the way we've always done it, right? And these rules mean these rules, right? And that's why I really sort of emphasize in my talk, not talking about the technology, but talking about the business that's changing here, right? And the way, you know, where places where we had human touches before, you know, we don't, our regs basically say, if you don't need a human touch, don't use one, right? If you can take attestation and check some data source later, we're fine with that. Right, that's, you know, kind of the whole vision of this. So if we need to have specific conversations, but the 90-10 rule and the 87 waiver, the carrots that start that, I think that if we need to have sticks later, we can bring in sticks later, but those feel like they're the way. But I will emphasize both of those are time limited.
Yeah, yeah.
Thanks. My name is Claudia Page. I'm with Social Interest Solutions, and this is kind of a follow-on to the A87 conversation. Maybe this is out there, but if it isn't, something that could also be useful to the field is an understanding of the more than 20 states that have invoked the waiver. What are the characteristics of their starting point and what they're driving towards? It seems like there's a lot of variability in how a state defines coordination versus integration, and just that could be useful information to understand in those 20 states who've already taken the trip or at least applied for the funding.
Yeah. We are working with specifically Joe, actually, on what we're sort of calling a state best practices. Is that what we're calling it? Yeah, yeah. So it's actually closer than draft at this stage of the game, but we have some changes that we're still working on for that. So you can look to see some of those kind of like stories coming out soon.
Hi, good morning. Zachary Jiwa, Chief Technology Officer for Louisiana's Department of Health and Hospitals. One of the things that occurs to me as I listen to the questions come in and listen to you guys is there's a lot of talk about horizontal sharing, both the funds and technology and the reuse of that. As Julie, you and I have talked in the past, and I'm thinking about how we build out the infrastructure in health and hospitals, and also thinking about how we share across Human Services, which is a different agency in the state of Louisiana. I'm curious about the federally facilitated exchange and what you're building there, and the potential of reuse of some of those services. Specifically, you know, is there an opportunity to leverage kind of a federal set of a rules engine, and then build specific things off of that for state requirements, or even smaller things like we've talked about in the past, Magi rules engines? Why should we be building those in a new E&E system, and why not be able to leverage those with an API through the FFE?
So this is one of those questions I'll probably answer a little bit out of both sides of my mouth, and Henry will stop me if I stray too far into FFE territory, because Henry's responsible for building the federal exchange. So within Medicaid and CHIP eligibility specifically, even with the Magi rules, there's still a goodly number of state flexibilities that are available. And many of those are implemented in the states now. There's specifically, I think there's like 20-ish of them. I can't remember the exact number, but we've actually been working with some states to make sure we have them identified correctly. And so, You know, the state-specific eligibility rules are state-specific eligibility rules, and trying to recreate those at the federal level is going to be challenging, okay? With that said, we're working on that, obviously. The other thing I will say is that states need to be able to do not just the initial eligibility determination, but they need to do, you know, redeterminations periodically, you know, and sort of manage their populations over time. So it feels like there needs to be some sort of MAGI capability in the states in order to do that work. So that's the path that we're headed down right now, is that, you know, states do need to have that capability. It needs to be state level. To help with that, the work in the Federal Exchange is creating things like business process models, which we've already actually put out on our CALT environment. I like to mention that almost in any audience, our collaborative lifecycle environment. So those are available in the Exchange community right now. They can be reused. The business rules themselves, not the implementation of them in our business rules engine, but the business rules themselves will also be made available as we're getting closer. So all of that stuff is going to be there and available for reuse by states. And we'll work through the usual processes that we're working on for technical assistance to help you with that. So the Federal Exchange is going to be there, right? And it, is going to be able to do MAGI determinations. The issues that are around states sort of like just saying, hey, you know what, I don't want a MAGI capability. I'm just going to use yours, right? There's obviously financial policy and some other conversations that would need to be had about that. And so we'd want to have those with individual states. But the Federal Exchange is advertised to be the Federal Exchange. And we're expecting right now Medicaid and CHIP agencies to fulfill their obligations under the regulations and have MAGI capabilities as well. But we're going to try to help accelerate that. So anything else you want to say on that, Henry?
How'd you guess? Zach, I think that, talking about reusability and, the ability for the feds to build something or anybody building something that can be leveraged in other places is really only half the conversation, if not less than half. I think we drive to a lot of, kind of very attractive discussions about, reusing IT. But we do it absent of an interoperability framework. And, I think the folks from Stewards of Change can tell you that, they operate at that layer. And when I first met them, I was very intrigued and enthralled and interested that someone was trying to stitch together, all the pieces on the business side, that you can build all the interoperable systems you want, but if you don't have an interoperable business process, it doesn't make a bit of difference. I think what we're talking about here is really embedded in so many years of inefficiencies, and not without like good reason, that programs grow up, and I see this in CMS too. They grow up in a silo sense because individual lines of business have to achieve certain program objectives in different time frames and using different funding sources. So they're all kind of moving, in this massively parallel execution, barreling down this highway and picking and choosing IT that matches, kind of their timeline and their preferences sometimes. So what we're trying to do is corral that and to project a point in the future, or several points, in which we can create some convergence, so that we get, business interoperability that's highly, linked to the technical interoperability pieces. So in the insurance exchange, we will build certain functionality, and I've had conversations with several people about this, the calculation of the modified adjusted gross income, which actually there is many definitions of that, and in the context of a complex integrated health and human services workflow, where there is a person shepherding an individual or a family or household, through this process, of which the new income rules based on MAGI calculation is all but like a very, very small slice of that very complex workflow. So even if we were to leverage that reuse, how many times do you have to come out of that workflow process, and hence the system, to talk to that service and go back? And is it feasible to do that? Or is it better for us to build it and to give it to states so that they can take that code base and integrate it into their systems? Then we had the discussion that sometimes, when we architect systems, data needs to stay close to wherever the rules are being processed. So if you're coming out of something to seek a service to do some computation, but the net result of that computation has to reside in your system, again, does it make more sense to kind of pull that into, kind of within your architecture, or does it come out as a service? I think there are many, many discussions that we have to have, and I've been very anxious to have these discussions with states about, as we build the FFE, and we have very little time left, particularly like if you look at plan management piece, that actually has to be up and running this October, November. And we're supposed to be in testing in September. That's 3 months from now. E&E is supposed to actually be in place sometime around January, February, March for us to start testing between federal agencies all the way down to the states. So there isn't a lot of time, and I'm not saying that that's an excuse, but we have to really focus on what Todd Park and Stephen Roekel terms as the minimum shippable product for October 2013. How can we pick that as the first point in time to create some level of convergence, and then pick additional points in time to fix the contracting strategy, the A87 cost allocation, the interoperability that's needed from business and kind of on the technical side. We have to have a much longer, lengthier conversation to map those points of convergence out. I'm not saying, again, I'm not trying to pick on you or like the other gentleman. It's a very good question, but I think that in all the years I've been working at CMS, it requires a very, very long-term commitment to a solid core set of things we agree on that we're going to build together, and we're going to kind of stay in this and to make that happen together. And that's very difficult to do.
Can I say something? Because I really appreciate what Henry just said, and it reminds me of something that I think happens with us very often, is that we do get excited. All of a sudden, we do have this opportunity, and we're very excited, and all the things that we could dream, we're ready to go with all those dreams. The problem is, and we have seen this over and over and over again, is that if you put the whole apple in your mouth, you're going to choke. Whereas if you take little bites at that apple and put it into a planning process that accepts the fact that we have short-term gains that we're going to get, but we need to keep our eye on the long term as well and know what we're planning and headed towards, we'll be more successful. And I thought I was hearing that a little bit from you, Henry, that there's certain things we can get done now. Please don't think that that means we're throwing something out. We're not. It's just a little further down the road. And so I think we need to keep our excitement, but also manage it.
Yeah, and I think that I'm just kind of repeating myself, I guess. There are multiple points in time in which we want to hit targets, and October 2013 just happens to be one of them. And then laying out, however you want to build IT, reuse IT, share IT, and create a more efficient, basis for providing that experience to the consumer or the recipient or the client that is at the end of all, this effort to provide an integrated set of services. I think that we really have to kind of do our homework and map that out.
When we think about minimum shippable product, the FFE is like any other exchange, right? It has an obligation for people who come to the FFE door to, basically take in a single streamlined application, to apply a set of business rules, and some of those will be state-specific business rules to that, use a standard set of verification procedures, and come up with an answer. And then depending on that answer, other things will happen. Even within that process, depending on what's going on data-wise, different things will happen. And so, the notion of asking Henry's team to kind of work and figure out what of those things that are involved in that process can be separated out, right, as callable services. So they can be integrated into any specific state's workflows. I think that from a state perspective, it would be almost equally challenging, right, to say how do we redesign our workflows to work with these set of services that the FFE is doing versus have our own set of workflows and implement those, right, at the state level. So I think that it's, both the conversations are going to be challenging.
So I want to take this opportunity, however difficult it is, to put an end to this conversation at this moment. This is torture for me, as we say. Let's get the conversation started. We are at our lunch hour, and I want to thank our presenters for your direct and honest feedback, and importantly, your receptivity and your openness to hearing more, and I want to make sure that we all have heard that there is an openness. And I think one of the things we're going to try to do, as I've said to each of you, and I've asked each of you, is at the end of this, we're going to work as hard as we can to come up with very focused, targeted, actionable recommendations, short-term, within the next 18 months, and longer-term. And what we'd like to probably do, as I'm going to suggest this, is we'll come up with a representative group to actually have that conversation with you, and then create this dialogue that will hopefully, sort of expand out to all the folks that they're working with and interacting with, and to kind of create that. Because I think one of the things we've heard is people have only a part of the apple, right, or a part of the picture. And sometimes this kind of dialogue is so important to hear it directly and to be able to then repurpose that back to your states and to be able to hear it from you directly and be able to accomplish that. I know that there's a bunch of other questions out here. And one of the things I think we'll try to do is capture those questions as they come up. As we said, we videotaped it all, so I know there's a lot of questions that you could all go into a great deal of more detail around. So with that, I want to say thank you.